Hello, my name is Sophie and I'm here to guide you through the lung cancer screening process with some help from our experts by experience. Cancer screening programmes are there to help individuals stay healthy and to ensure they receive treatment early to enhance their quality of life. Sometimes individuals with learning disabilities face many barriers when accessing screening programmes and can cause some anxieties. This is why we are here to support and guide you through the process and to highlight any resources you can access. The Lung Cancer Screening Programme invites eligible individuals such as those who are current or former smokers between the ages of 55 to 74. There are many steps to the lung cancer screening process which may be overwhelming, so we hope these videos will help guide and support you through each step.
When you come to the age for lung cancer screening and are registered with your GP as a current or ex-smoker, you will be sent a letter. Once the letter has come through the post, it will be inviting you to have a telephone appointment with one of the lung cancer screening nurses. The appointment should take around 30 minutes to complete, and they will ask you some questions about your smoking history and about your breathing. They will also ask about your everyday life and your medical history. The nurses will not rush you and they will make sure that you have plenty of time to answer any questions. If you are unable to speak to the nurse or you are anxious, it is okay to have someone with you who can assist you during the call. The nurse will also ask you for your height and weight and will also ask if you have any mobility problems to see if there are any additional support needed. It is important to know there is no hoist available in the lung scanner unit. If you prefer a face-to-face appointment instead of over the phone, let the team know and it can be arranged. The number is on the letter. After you have answered all of the questions, the nurse will inform you one of the following outcomes. No problems found. In this case, the nurse will contact your GP so they know you have had a lung check appointment. You may be asked to come back in the future. Go see your GP if the nurse finds you have problems with your breathing or your lungs. They may suggest that you go and see your GP. Offered a lung scan, the nurse may suggest you go and have a scan of your chest if they think you might need one. Don't worry if they don't invite you to a scan. This may be due to your not needing one at that time.
Hello Leanne.
Hello.
Thank you very much for joining us today.
Yeah, it's all right.
As you are one of our experts by experience, I'm hoping that we can have a conversation about your experience around the lung cancer screening, if that's okay.
Yes.
So I am under the understanding that you have received a letter through the post.
Yes, I did receive a letter through the post.
Because are you an ex-smoker or current?
Ex-smoker.
Right. So your GP obviously told them to send you a letter because they're in your area for
Yes.
screening. What did you think when you received your letter through the post?
Well, I ended up having to talk to my neighbour,
Right, okay.
so my neighbour could read it.
Because you struggle to read the letters, don't you?
Because of my dyslexia, yes.
Was there a lot of information on that letter?
A lot of information on the letter.
Yeah. How long after you had your letter did you have the phone call? Was it a few weeks?
It would be 2 weeks.
2 weeks. Oh, that's not too bad then. So they're quite quick, aren't they?
Oh, yes.
Yeah. So when the telephone call came through, what did the nurse ask you? What type of questions?
At first she said, on our knowledge you used to smoke. When did you stop? When did I start? I said I started at school and I stopped roughly a year, well not a year, a month after my dad died.
Right, okay.
And I've been stopped for quite some time. How long is some time? I said 20, 25, 26, 27. I was going right the way through to about 29 years.
Did you find it easy to recall
No.
your historical? No, was it quite difficult?
Quite difficult, especially when I have a non-retentive memory.
Yeah.
And in between the times I had suffered from depression, so
Right.
it was
A little bit fuzzy.
fussy.
Yeah.
She did say, because I had stopped for so long, I might not need it.
Oh, that's good.
And then she asked me, have I had consecutive cough? Have I been breathing, and is it normal breathing or not normal breathing? Am I on inhalers or
Yeah,
anything
medication for your breathing.
like that? And what medication am I on? Told her what medication I was on. Then I got given a lovely bit of news. You do not have to continue anymore.
Which is good.
Yes.
So they asked you all the questions that you need to do, signs and symptoms or anything like that, and there was no concerns.
No.
That's brilliant. Did they ask if you needed any additional support when you was on
No.
the phone? Did they ask if you had a learning disability or learning difficulty? Nothing like that.
Nothing.
If she did, and if you had the option of possibly a face-to-face appointment, would you have preferred that?
Oh, yes.
So I think you would have felt a little bit more relaxed and able to recall historical information if you was face-to-face.
Because when it's face-to-face, you feel as if you can recall better because you've got a person looking at you.
Yeah.
It's very strange, but you
It is.
need that
Yeah.
personal thing.
Yeah, and sometimes it's easier to understand what's happening and you can hear them properly and
Yeah.
communicate better when
Definitely.
it's face-to-face. It is one of the options, but obviously if you couldn't read all the information on the letter and it was a bit difficult for you, how was you supposed to know?
No.
This is the thing. So after you was told that you didn't need a scan, did they say they was going to contact your GP and let them know that you've had that call?
They were going to say, I've had the call, but nothing else.
No. Did they say they was going to have a follow-up or anything in a few years? No.
No.
So they were just happy that you're okay, you've got no symptoms and you didn't need the scan,
Yeah.
which is brilliant. Which is
Definitely.
really good, and well done for quitting. It's always a good positive.
Well, I used it like you would do antidepressants.
Yeah.
I was using that,
It's a coping mechanism.
yes.
Yeah.
And I developed some other coping mechanisms that were not so risky.
Yeah, on your body. Yeah,
Yeah.
which is a good call. But I'm glad that all turned out well and that you was okay and you didn't need the scan. That's brilliant.
Thank you.
Thank you so much, Leanne.
Thank you. If the nurse decides you need a chest scan, you will be sent an appointment through the post, inviting you to your local lung mobile screening unit within your area. These locations can be at supermarket car parks, hospital, car parks and other local areas. When you arrive at your appointment, you will be greeted by a member of staff. You will be able to come with someone to support you, but they will not be able to come into the scanning area when the scanning is in process due to safety. There are 2 different screening units currently in use. Sometimes there is one screening unit where you will do both the assessment and the scan. And there can be 2 units, one for assessment and one for a scan. Don't worry which one you're invited to. They both do the same screening process. The mobile scanning unit can be accessible. There is a lift for those who have mobility aids as well as stairs. When you enter the screening area, a member of staff will introduce themselves and will ask for you to confirm who you are and that you are there for a chest scan. They will ask to check your height and weight again and talk about consent. If you have a health passport, please bring this with you, as this will help the staff to support you throughout your appointment. Before you start the scan, the staff member will explain the process to you. They will take their time with you and make sure you fully understand. There is no need to get undressed. The scan can be done fully clothed, but it is important not to wear any clothing with metal zips, buttons or poppers, any jewellery or underwired bras in the chest area, as this will interrupt the scanner. You will be asked to lie on the bed that is connected to the scanner. The scanner looks like a big holo. Don't worry, it may look scary, but it will not hurt you. Once you are comfortable, you will be asked to put your arms above your head and lie still. If you struggle to lift your arms, please let the staff member know and they can support you to find a better position that is more comfortable. The staff will then go behind the screen where they will be able to control the scanner and still communicate with you.
Okay, Dawn, we're ready to go now. Are you okay?
The bed will be raised up and will slowly enter the middle of the scanner. This may feel as if you are going under a bridge. Once the bed has placed you under the scanner, the machine or staff member will inform you to hold your breath for 10 seconds.
Okay, Dawn, the scan's going to start now.
Please breathe in and hold your breath.
If you are unable to do this, just inform the staff and they can support you. When the scan starts, it may be noisy and will only take a few minutes. You can use earplugs or ear defenders to help if you don't like the sound. The staff will speak to you and will ensure you are okay throughout the procedure.
Are you okay, Dawn?
You won't feel anything during the scan. Once the scan has been completed, you will be brought out of the scanner and lowered back down so that you can easily sit up and get off the bed. The staff member will check that you are okay and will advise you that you will get the results through the post.
Hi Dawn.
Hi.
Thank you so much for coming today. As one of our experts by experience, we're going to have a chat about the lung cancer screening, if that's okay.
Yeah.
Yeah. So I know that you have been for a lung cancer screening scan in one of the mobile units in one of the supermarkets in your area.
Yeah.
What was your initial thoughts?
I was scared.
Was you?
Yeah.
Was the bus quite intimidating or?
Yeah, it was like the last time I'd been in like a tunnel, the second time, but the first time was because I got kicked in the head.
Right.
And I had to have it was a big scanner.
So when you first saw the bus, because
Yeah.
it's a big white van type thing, isn't it?
Yeah.
Did you go and did you see one bus or did you have 2 buses?
One bus.
Was it one bus that you
Yeah.
went to? Right, okay. So when you went to the bus, did you have your walker or did you go with somebody to support you?
I went with Lauren.
Oh, did you? And
Yeah.
she's your support worker?
Yeah.
Did you have to use the stairs or did you use the lift? Was it available?
We used the lift.
Okay. And how did you feel about using the lift?
Oh, okay.
Yeah? Wonderful.
Yeah.
So when you first got there then, was you greeted by any staff?
Yeah.
Yeah? Were they very nice?
Yeah.
Did they talk you through the process?
Yeah.
Did they do any checks with you?
No.
So did they check your height
Yeah, they checked my height and my weight.
and your weight, right? And did they tell you why they needed to check that?
Don't know, I can't remember.
That's fine, because usually they ask you on the phone as well on your
Yeah.
appointment, and then they do a double check just to make sure so the levels of the scanner is
Yeah.
correct for you. So then did you have a chat with one of the nurses?
Yeah.
Yeah. With that conversation that you had with the nurse, did she ask you about any support that you would need?
No, not that I can remember.
Did you take a hospital passport with you?
Oh, yes.
Yeah.
Yeah.
Because that has all that information, doesn't it?
Yeah.
So that would be quite interesting for them to have that, because then they can support you in the ways that you need to, especially with your mobility.
Yeah.
And when you was there, did they ask about your consent to the scan?
Yeah.
Yeah. And you was fine with that?
Yeah.
Wonderful. So, okay, now we're getting to the good bit. So when you came to do the scan, so you went into the unit, didn't you, on the lift,
Yeah.
and you saw the scanner itself.
Yeah.
How did you feel when you saw that?
My heart started beating a little bit.
Oh, did it?
Yeah.
Is it because you've had past experiences with
Yeah.
similar
Yeah.
scans? Yeah. Because it can be quite scary, can't it?
Yeah.
Because it's quite a big machine, and the Polar is quite big as well, where the bed goes into, isn't
Yeah.
it? Yeah. So did the staff help you get onto the bed?
Yeah.
Yeah. And did someone go with you to support you?
Lauren came for a little bit
Yeah, did
until we started filming.
Right. So when Lauren came with you to the scanner and you sat on the bed
Yeah.
and you got laid down,
Yeah.
how did you feel with your arms up?
This arm was hurting me, so
it?
Lauren asked if I could put it down like that.
On your belly?
And I just had the one bit out my head and laid down.
That's good that they made that adjustment
Yeah.
for you, because obviously it's important to have the scan, and not everybody can put their arms up, can they?
No.
No. So once they got you into position, you then, did you go into the machine?
Yeah. Not
leave.
right into the machine.
Okay. Did you go so far up to?
Yeah.
Right. Did Lauren have to leave the room?
Yeah.
Okay. And was you on your own then?
Yeah.
How did you feel when you was on your own?
It didn't seem a long time, and it wasn't a long time.
That's good. Was you okay when they were asking you to hold your breath?
Yeah.
Yeah, that's good.
Yeah.
So then once the scan was happening and it was going off, did you hear any noises?
Yeah.
Yeah. And were they okay for you?
Yeah.
Yeah, they didn't scare you or anything?
No.
Good. Because it doesn't hurt, does it?
No.
No. Because all it does is literally put you through and then bring you back out.
Yeah.
So after you scan them, after them few minutes, they brought you back out and they lowered the bed back down.
Yeah.
Did somebody come and help you get off the bed?
A nurse came to get me off the bed, and Lauren helped him. And then me and Lauren just sat on the edge of it, like I had to sit up, but I couldn't get straight off the bed in case I went dizzy.
Ah, right. So they gave you a bit of time to
Yeah.
kind of adjust from
Yeah.
being laid down. And that's good. They didn't rush you,
Yeah.
because we can't have you rushing, because you might be dizzy.
Yeah.
When you was having your scan done, was the staff very supportive for you?
Yes.
Yeah. Did they give you reasonable adjustments?
Yeah.
And did they recognise you was a bit anxious?
Yeah.
I'm glad that they were able to support you in that way, because it
Yeah.
is important, because not everybody finds it comfortable, and it is very scary, especially
Yeah.
when you haven't had one before.
Yeah.
But I'm glad that they supported you.
Yeah.
And then did you go straight home?
Well, then I went for coffee first.
You, did you?
Yeah.
Oh, yeah, I think you deserved
Well,
it.
Lauren had coffee, I had cocoa.
You deserved it after that. 'Cause
Yeah.
you were so brave. You did really well doing your scan.
Yeah.
And we do need to have our lungs checked, don't we?
Yeah.
Especially when we're smokers or ex-smokers.
Yeah.
Yeah. Thank you very much, Dawn.
All right then.
You will not be told your results during your scan appointment, as the scans need to be checked by a medical professional. Your results will come through the post within 4 weeks from your scan. The letter will tell you what will happen next. They may advise the following. We found nothing to be concerned about. This is good news, and you will be invited for another scan in 2 years. You will need another scan. This usually means that they may have seen something and that they need to check again. If this happens, you will be invited by letter for another scan. Something is wrong. This means the scan has picked something up and you need to have more tests and be seen by a health professional. You will be called and invited to the hospital to have a chat. Something else is wrong. The scan may have picked up something else other than lung conditions. If this happens, you will be advised to see your GP or be invited to the hospital to see a health professional. All results from your scan will be sent to your GP to keep them updated with the outcome of your scan.
Cancer screening programmes are an important checkup, and they are available to ensure you are fit and healthy. It is important that when you are invited to a lung cancer screening appointment that you attend, but it is your choice and you can stop at any point during the screening process. It is also important to look out for signs and symptoms of lung cancer, such as a cough that doesn't stop, coughing up blood, and an ache or pain when you breathe or cough. If you notice any of these symptoms, you should go and see your GP. For support to stop smoking, you can speak to your GP, or you may be able to be offered support throughout the screening programme. We would like to thank everybody involved in creating this video, and most importantly, our experts by experience. You can find more information about lung cancer screening from the organisations shown here.